Professional Development Manager for the Early Learning Coalition in Marion County. Welcome, welcome, welcome to our September provider meeting. As you can see up on the screen, we got Muckin for Marion. We have our CEO, Carrie Thial, and our board chair, Todd Panzer, who have lovingly taken up the challenge that if we can raise $10,000 in donations, our partner Stirrups and Strides has a stall that they can muck up while dressed to the nines. So if anybody would like to help us meet that goal, please feel free to scan the QR code. And in the spirit of that, I just want to give a shout out to those providers who have already submitted donations and graciously supported us during Give for Marion. We have Miss Gwen Wilson from Wilson's Lovable Daycare and Mr. Cecil Wilson from Mary's Family Home Childcare and Andrew from All Stars Learning Academy and Miss Erlene Cart from First Assembly. Thank you so much. And just a shout out to our Family Home Childcare providers, Marion County Association. They also donated to us, and that's just so special. It's good to know. Thank you. And so we're going to move on. Those are our celebrations. I am very excited to say that we have some new staff members on board. And we, in the spirit of and because I know how important it is for you guys to know who to call for what, in your provider packet is an updated employee directory. Please feel free to download your provider packet, hint, hint, so that you can get that plus all the other resources that we go over today. So make sure you check out those handouts. Okay, and I'm going to go ahead and give it to Elizabeth to introduce some of our new members on our staff.
Hey, everybody. We do have some new people joining us, and what I'm going to do, because I can't see who's on the call, I'm just going to ask our team to unmute and just introduce yourself and what seat do you sit in here? What's your position?
Okay.
All right. Hello, everyone. I'll go first. This is Janet Honor. Sorry. This is Janet Honor. I am your Provider Relations Manager.
Hello, I am Mary Brewster, and I work in Provider Relations.
Good afternoon. My name is Melissa, and I work with the Provider Relations.
I don't know if anybody else is on the call from our team. We do have a one of our new staff. Let me make sure I state her title correctly. She is our Early Childhood Program Director. So Dr. Michelle Grant Harris is joining us, and she is on board, and she's on day 3. So we are super excited to have her here. She's going to be overseeing all of our parenting initiatives, including Help Me Grow, the Dolly Parton Imagination Library, which we just received some grant funding for, as well as the introduction of Incredible Years, and that is going to be a parenting component. You all as providers will see Incredible Years introduced to you later on next year for your classroom management. There's a classroom management piece that we're going to be adopting and rolling out to you. That won't come for a little while. But if you want to do any research on Incredible Years, it is an evidence-based program that supports early learning, and we are going to focus on parents of children 3 to 5 years old to begin with. They do have other pieces that are like an infant toddler focus, and then there's one that I'm really excited about, which is focusing on autism and children with different needs. We will eventually be rolling those out to families and parents, and not yet though, but I'm really excited about that.
And Michaela, I got you unmuted if you want to introduce yourself.
Hello, I am Michaela Powell, your Program Compliance Director.
All right. Okay. So we'll go ahead and move on in the agenda. Thank you everybody for sharing and shouting out. If I missed you, I apologize. So we have a guest speaker, Ms. Jamie Harmon. And I'm going to go ahead and switch my screen here.
There you go.
And
Beautiful.
yes, Miss Jamie Harmon. I hear you, Elizabeth. Thank you. So Ms. Jamie Harmon is from the University of Florida Lassiter Center for Learning, Academic Support Specialist. Did I get that right, Jamie?
Yes, you did.
And she's going to be talking about micro-credentials.
Yes. Hi, everybody. Good afternoon. Thank you so much for having me, ELC of Marion. It's a pleasure to talk with everybody. I know there's been so much training over the last year, but we've got kind of the next level for you. Right now, we are offering the literacy micro-credentials. We have a literacy micro-credential for pretty much every age group. We have our emergent literacy, which covers birth through pre-K. There is also an elementary version that covers pre-K through 5th grade, and there is even a secondary version that covers 6th through 12th grade. So this was developed in conjunction with the Division of Early Learning and is available free to all providers in the state. So this is not just a traditional one of the Flamingo early learning courses you might have heard about or a DCF click-through course. This is 60 hours or 6 CEUs total, and you do earn this credential in emergent literacy or the elementary, depending if you're a pre-K teacher, what you would like to enroll in. So it does take a little bit more time, but there's a little bit more benefit to that as well. So we do break up the 60 hours into 3 components, 3 20-hour components. Component 1 is actually one of our Flamingo early learning literacy courses. So if you are Flamingo with Flamingo Early Learning and I think I might have taken preschool language development or the building blocks of preschool literacy or infant toddler language development, then we can always verify for that, that for you. And essentially, if you took that course after 2018, we are following the same timeline as it was for the emergent to count towards your BPK emergent literacy. It had to be taken after a certain date. So as long as you took it after that date, we can actually count that as your component 1 course. Component 2 are our emergent literacy modules. There's actually 4 modules. It looks like 4 courses that show up for you, which sometimes can be a little overwhelming, but they are only about 5 hours each. So total, they make the 20 hours, and those are self-paced. Component 1 is one, if you're not familiar with Flamingo, we do have time-bound set start and end dates. And you do have cycles that have assignment due dates on them, so you need to make sure you are keeping up with them. It's typically about 2 hours worth of work every week, 3 assignments due each week. The modules are more like a DCF course that you are used to. They are self-paced. You don't have any assignments. You have our interactive activities, and there is a post-test at the end of each module that you must pass. And then component 3 is the practicum, which is, again, you have an instructor there to help you, but you are submitting 4 assignments that go along with the strategies you learned in component 2. So that's now trying these things out in the classroom. And when you complete all that, you are actually eligible for a $2,000 stipend. Currently, our stipends are open for school readiness and VPK personnel. But as of July 1st, the legislature did open that stipend up to anybody in a child care setting. So we are working on expanding that stipend out for more people who do not have to be contracted with the ELC for services. So that is very exciting. So the completion time frame is really up to you. It's essentially you get enrolled in component 1 and 2 at the same time. So you can take those as it permits for you. You could take them at the same time. You could take one after the other, whatever works for you. You just do have to have both components completed before we enroll you into component 3. So just keep that in mind. We do have component 1 terms starting October 9th and November 6th, and we do have 1 or 2 after the new year. I am going to, Liliana, I am going to put the link to the website in the chat that gives them that information and the link to the enrollment form. So if you want to get that out there, please visit us. And I'm also going to pop my email that she can share. So if you do have additional questions and want to talk about it, please feel free to contact me. We are more than happy to help you. It's a great program. It's got an amazing stipend attached we haven't seen before for early child care educators. So we absolutely want to make sure we get everybody in that we can. I know, especially if you are a VPK teacher, you're like, I don't know how much more literacy I can take because you had that 15 hours last year. But I feel like this is kind of the next level of that information. The foundations of all that good information you got last year. Now we are getting more into what the science of reading is. So we really see how those foundational skills feed into that kindergarten readiness and what kids need to be successful as they start into their into the primary grade levels and more formal reading and writing instruction.
That was awesome. And I am sending this link to everyone. And I will also include it in our provider newsletter and our professional development newsletter as well, Jamie.
Thank you.
You're so welcome.
Please forward any questions. I do have another meeting I have to jump to, so I'm not able to stay on. But guys, she has my email out there. Please email with me with any questions, or if you get them to the coalition, please forward them on and I'm happy to answer them.
You know I will. I will definitely forward them to Miss Jamie.
All right.
Thank you so much for your time.
Thank you guys. Have a great day.
Okay. For those of you who may not be aware, you can go to our website, elc-marion.org, and sign up for our Constant Contact communications. Our Constant Contact does provide the provider newsletter and the professional development newsletter, as well as all notifications related to school readiness and VPK. Very, very important if you don't have that, have yourself signed up for that communication. Thank you again to Ms. Jamie Harmon. If you have it, yes, I will be happy to do that, Ms. Lisa. It'll be sent in the link will be sent to the Constant Contact in the provider newsletter that's sent out to everyone. Okay, and do we have any partner updates? Please raise your hand if we have any partner updates. I'm looking for raised hands. I don't see any. Okay, so now this brings us to VPK updates. And we're going to kick it off with VPK Providers on Probation update with Miss Elizabeth.
Hey everybody again, this is Elizabeth. So on the last call, and I think a call prior to that, I talked about VPK providers on probation, or otherwise referred to as POP providers. So the probation status refers back to the kindergarten readiness rates. Now, those of you that are pretty new to VPK are probably like, what is that? And rightfully so, because there hasn't been a new one released for a couple of years. And unfortunately, what that has caused is, so let me back up a step. The VPK providers are measured on their performance of preparing children for kindergarten through what you know of now as the FAST early literacy and the other components that the children are taking, the progress monitoring piece. So VPK providers are given a score, and the score ranged anywhere, and this was a previous score, and we do not know what it's going to look like moving forward, but basically providers were given a score between 0 and 100 based on how their students did on the Flickr screening that occurred, and then the STAR early literacy that transitioned after that. The last score that came out was for 2021, I believe. Lily, correct me if I'm wrong, but
No, you're correct.
thank you. So we received an audit from the Division of Early Learning, and one of the findings on our monitoring audit was that we were not making sure that our providers on probation renewed their, thank you, Lily's pulling it up on her screen right now, that our providers did not update their improvement plans based on new staff that they hired. So we are now going back to work with providers who have remained on probation since the, I believe, 1920 year. We have providers that we're having to go back and connect with you to have you update your improvement plan. So the first thing that we need you to do is log into where Lily is showing you on the screen. Thank you, Lily. You're going to log in here, and if you have a hard time logging in, please let me or Lily know, and we'll walk you through it, or we'll try to figure out how to get you logged in. But you're going to go in and you're going to acknowledge that you are a POP provider. Some of you that were POP providers back then, we were able to get you removed off the list. Others of you are like, I am not a POP provider, I haven't been, and I had to come back and tell you, unfortunately, we are having to go backwards. So basically what we're going to do from here is we're going to have you acknowledge your status. And then I'm going to ask you to review the improvement plan that you've already submitted. What you're going to be looking for is what staff are listed on there who are no longer with you, what staff are missing that are with you. And those are going to be the primary components that we're going to be looking at, is what trainings do your staff need to catch you up, and we're basically going to have to redo your improvement plan with the new staff that you added this year. So let me pause, that's a lot. And it's not an easy thing to disseminate, so I want to make sure that I'm as clear as mud.
I think you're a lot clearer than mud.
Okay, good.
Just so you guys know, this is the readiness rate site that you would log into, and if you wanted to look up your readiness rate score as a VPK provider, this is where you would look it up. And like Elizabeth said, we're going to be working with you one-on-one, and contacting you as well. Any questions? I'm looking.
The first step with this is really to get you logged in
questions.
here. Yeah, we want to get you logged in here, make sure you're looking at what the improvement plan that was previously submitted, that you did all this work. All of our providers worked really hard on your improvement plans, and you finalized them for the fiscal year that the plans came out. So now we're looking at updating those plans and adding any new staff that has joined you for your VPK program this year.
Okay.
So that's really where we're at. So what we're going to do from here is we're going to keep tabs on who's logging in and who hasn't. We're going to connect with you all one-on-one and provide some technical assistance. And Lily, and then one of our new staff members, she's not new to the coalition, but she's new to our department, Destiny Newbern, has transitioned over to the quality department. Lily's going to train with her to be a good support for you all in this process.
Okay. All right. And next we have general progress monitoring discussion with Miss Janet Honor.
Hello, everyone. Okay. So to discuss progress monitoring, as you know, your PM1 is coming to an end, and it is very important that all VPK providers make sure that all of their enrolled VPK students have taken the assessment for PM1. I also want to share with you guys that the dates for PM1 have changed a little. It's no longer going to include non-instructional days for the PM cycles. So it's just now 30 instructional days. PM2, that stays the same. PM3 again, 30 instructional days. I listed all of this information here in my notes for you to keep, hang up, file away, so that you have it. Okay. Do we have any questions regarding that?
I'm looking, and no questions at this time.
Okay. We will be working on following up with providers to give you guys all of your PM dates for 1, 2, and 3. Once you have that, please keep that on hand so you know that you can have it to refer back to. Complete it on time so that you are not out of compliance. Okay. So that's it for me for progress monitoring. I'm going to go into school readiness. This is a fun topic. Hey, so, and I'm going to say, please don't shoot the messenger.
You got
Um,
this.
I know I do, thank you. All providers will receive an email with their new composite scores and detailed reports from their class assessment, their class observation. With that, it is very important for you guys to now know that the most recent composite score must be updated within the provider's school readiness contract. This is only referring to school readiness. The new score and differential rate will be effective in the following reimbursement month, okay? That following cycle. A provider's differential, it can either increase or decrease based on, or I put an example here for you. So if a provider has a previous score of 4.5, and then the provider receives a new composite score of 5.54 on 9/20, which is today, a contract amendment will be initiated and certified to reflect the changes that will be effective on 10/1. So that's that following month. So if you have a score that is here and you end up getting a lower score on your new assessment, we have to do a contract amendment. Even if your score still in that same differential in each, if it's in the same increase, if you still get a 7%, I have to do a contract amendment to reflect the new score on there. So please watch out for your emails with your composite scores. Also watch out for your emails that will have information on how to complete your contract amendment. Also, please don't let your amendment sit in the queue for weeks and weeks. I'm going to bug you and call you and email you so that you can get your amendment signed. And this is not just for, you know, your composite scores. Any amendment that you have, we don't want it to sit in the queue too long. Below is the QPI differentials. As you 4 to 4.9, is 4.5 to 4.99. That's 4% increase. 5.0 to 5.99, you have a 7% increase. And 6 to 7 is your 10% increase. I know that was a lot. Are there any questions there?
No questions so far.
Okay.
And I don't see any hands. So
Okay,
I
good.
guess,
So we're good.
oh, can you repeat the fees?
I
There's no,
can. There's no fee. It's a differential rate. It's a rate that you're going to receive. So you get like a percentage increase for your composite score. And again, 4 to 4.49, that is no increase. 4.5 to 4.99, that's your 4% increase. 5.0 to 5.99, that's your 7% increase. And 6 to 7 is your 10% increase. Please save my notes for your records. This information is listed here, and just save it for yourself so you know when you see your composite score come in, you know what your differential rate will be. Okay?
and this information is in your provider packet available to be downloaded. I'm seeing a lot of people want this information emailed to them. This information will also be available through our Constant Contact provider newsletter. If you have
Yes.
not already signed up for Constant Contact through our website, elc-marion.org, I highly encourage you to go ahead and do so that you receive information like this that is sent to you all the time through Constant Contact.
And may I add
Thank you,
something
Lily.
real quick?
Yes. Yes.
This is Elizabeth, everybody. So when Janet's talking to you all about these quality performance differentials, this is extra funding for you. So all of that work that you and your team have done over the past couple of years with all of this training, like Jamie Harmon was talking about, this is where it pays off for you. So when we're talking about differentials and things in your contract, that is an increase above your reimbursement per child. So that's how that works. I just felt like I wanted to make sure we said that for anybody that didn't really know, you might be new with us
Yeah.
or
Mhm.
just so that you know, it's a 4% increase for your enrollments in school readiness.
Are
Thank
there
you.
any other questions, Lily?
Checking. And no, ma'am, not at this time. Thank you so much.
All righty. Well, thank you guys.
And that leads us back to our agenda. Michaela Powell. Oh, excuse me. Nope, I was wrong. Miss Elizabeth, did you want to talk about health and safety updated
Oh,
handbook
sure.
guidance?
Yes, in your packet. So at the last call, we talked about the changes to the health and safety guidance. In your packet, Lily included guidance that just came out last Monday on the 11th, and it talks about what is going to happen with the additional trainings. There are some additional trainings that are listed and that are required now through the health and safety guide. The handbook we distributed on the last call, and it is readily available if you need it again. But this memo is here, and what we are planning right now is we're working to put together a kind of a mini training overview for the new health and safety standards. So just watch your professional development newsletter that comes out so that you can have somebody join us to learn what these requirements are. They will impact anybody that is contracted for school readiness.
And just so you guys know, just in case you needed it, the health and safety presentation that was made available in the August meeting is available to be downloaded again in the handouts.
Yep.
And the memo is in the provider packet. And here's the memo, which I'll touch on later when we get to professional development. All right. Is Miss Michaela Powell ready to rock and roll with some parent copays on Compliance Corner? Miss Michaela? Let me make sure I didn't unmute you, or I didn't.
Hi, yes, I was muted, sorry.
There you
Yes, I'm gonna go briefly go over the parent copays. In the Rule 6M-4.400, the collection of the family's required copayment for school readiness services shall be the responsibility of the provider of school readiness services in accordance with Section 1002.84 in the Florida statutes. The provider must give the parent a receipt for each copayment made by parent and retain receipt records for all child care copayments. Based off of the monitors that we do for the school readiness monitors, it's a part of the monitoring tool and the assessment activity. It does ask to review documentation that validates parent copayment collection by the provider for the children in the sample that's selected. Also, I did want to go over briefly just the transfers because it has to deal with the co-payments. A parent may not transfer his or her child to another school readiness program provider until the parent has submitted documentation from the current school readiness program provider to the Early Learning Coalition stating that the parent has satisfactorily fulfill the copayment obligation related to school readiness program. Satisfactory fulfillment of the copayment obligation is defined as immediate payment of the outstanding copayment obligation or establishment of a repayment plan for the outstanding copayment obligation. So basically, when the parents call in and want to do a transfer, we have to make sure they have a zero balance. The zero balance is basically we're looking for the copayment is that they have satisfactorily fulfilled that part of the payment, not any additional fees that you may have for the parent. So you would just need to possibly work something out with the parent or for the additional fees, but as long as the co-payment fees have been fulfilled, then we are able to transfer the parent to another child care provider.
I'm
Okay, are
looking to
there
see
any
if
questions?
I'm looking to see if we have any. No questions at this time. Oh, wait, there is a question. Okay, so I have a question. Many of us use electronic auto draft payments. Can we print the payment log as a receipt to show you?
We don't have to see it. The receipt is just the form that you do for the zero balance to give to the parent, or are you speaking of the receipt for us to give to compliance?
She's referring to when you come to monitor.
And she says she has a printout as long as it shows that the payment. Yes, if it's a receipt that you give to the parent as well, if it's something you give to them, or if just any record showing, the payment that you have collected from the parent.
Okay, so Michelle, they get it in their online account, she's saying. But if she can show you a payment log, is that acceptable?
Correct.
Okay. Does that answer your question, Miss Michelle? Yes, she says. Beautiful. Okay, I'm looking to see if we have any other questions. Do not see any other questions. I did see a concern. There were some people having trouble downloading the handouts. If you're having trouble downloading the handouts, please know that the handouts will also be made available through our provider newsletter through Constant Contact, and you can download them from there as well too. Okay, and then next on, if there's no more questions, looks like we're good. All right, so next we have professional development. And I am going to bring up our memo with the update approved revisions on the rule 6M-4.620. Yes, I'm cheating. I'm reading off of the memo. Hopefully you guys are reading with me. Yeah, don't be impressed. I didn't have that memorized. But what I do have memorized is that you guys are going to need 2 new classes for school readiness. But I want to make this very, very clear. And I encourage you to read this along with me. So we have new health and safety courses are being developed to include these revisions to the rule. Courses will be available January 1st, 2024. To comply with the federal regulations, all school readiness child care personnel must complete these 2 new health and safety courses by June 30th, 2024. So again, they're not even going to be available till January 1st, 2024. And you have until June 30th of 2024 to get them done. And the 2 courses that we are referring to is the Health and Nutrition and School Readiness Program and the Safety Practices in the School Readiness Program. And this applies to school readiness providers only. And if you have a copy of the Health and Safety Handbook, you'll see that these courses are listed on page 7 and 8, section 3.2, where it refers to trainings, required trainings. And then on page 9, in the handbook, it also refers to that pediatric CPR is also, in first aid, which is listed right here in the memo, is also required. And I understand that puts our CPR courses in great demand, and we are working to get that scheduled. And our next CPR course will be announced and put on our website calendar once it's made available. But until then, if you are needing to get connected with some people who can help you get your CPR, you can email training@elc-marion.org, and we can give you some suggested resources that you can use at your discretion if you're having trouble finding somewhere to get your CPR and first aid certification. Okay. Let me see if there's any questions about that. emceeing becomes a little interesting when you're the one presenting. So let me just look up here for a second. And a copy of this memo is available in your provider packet, and it will be made available in the provider newsletter. And I'm also going to put a copy in the professional development newsletter too. Any questions? I don't see any questions in the chat. Good. So then I will go on to VPK POP, Professional Development Update. For those of you who were our VPK POP providers or providers on probation due to the readiness rate score that the site received, if you chose the target for staff development plan, I want you to know, don't relax, it's gonna be okay. Because any of the outdated courses that are no longer available, we will be replacing them with the emergent literacy courses and the FAST assessment training that you guys know to be VPK test administrators, getting started with FAST early literacy assessment. That's a mouthful. Try saying that 3 times. So we're looking to make this transition as seamless as possible. And chances are, if you have a VPK app, more than half your staff have this training already, because you can't contract without having a lead teacher that has these requirements. So that's going to make it even easier to make that transition. So I just wanted you to know that from a professional development standpoint, we're looking to utilize those trainings that are available now and are required already to meet those requirements as they're set in the staff development plan. And that also includes the updated phonological awareness. And we'll get into more details when we catch up with you one-on-one and work with you together. You are not alone in this process. And then let me see if there's any questions. I don't see any questions. And just know, guys, that this meeting is recorded and will be made available on YouTube within the week. The last thing I wanted to touch on before I give the floor to Miss Elizabeth again is that in your packet, we also have a Kaleidoscope flyer. And this is I've had received some inquiries about where we can get parent trainings. And here's your answer, guys. Here's an opportunity. Kaleidoscope is a flyer in the provider packet where parents can go to the Parkside Gardens Apartment Community Room on Wednesday from 10 to 11:30 and get some, they can bring their kids and learn about best practices and parenting and other resources while they're there. And that, let me see if there's any other questions. Okay, then I will give the floor to Miss Elizabeth.
Hi again. Okay, we are going to talk about ARPA and other grants that we have distributed to you. So this process, as you guys know, you've gone along with us, and thank you so much for all of your patience. And we've heard from many of you that these funds have really helped you keep your site open and to serve more children and to recruit more teachers and to update things that needed attention at your sites. So we're really happy to support you in that way. So on your screen right now is an email that went out last Friday to you all that talked about ARPA grant payments and deadline updates. I don't think you have to drive it, right, Lily?
Yeah.
Okay, perfect. So in that constant contact email was this information that you see up on your screen. It's also an attachment in the handouts there. And then you also have it in your email from last Friday. But we needed to remind you that the spending time frame for the ARPA grants is you have to spend those funds by September 30th, 2023. So the ARPA grants, and let's see what we're requiring and what you need to have on file basically for this. In the event that you get monitored, because we do have to do the random monitoring, you would need to provide us with the invoices showing where you were billed for the purchase, and then you would have to show us where you ordered the materials, how did you get to pay that particular vendor for a service that you bought with ARPA funding. I do recommend that you go back into your provider portal and look at your applications that were on file that were approved for all of the different ARPA grants, which we're going to go over the timeline here in just a minute. And I color coded it. So the things that were in green, they're highlighted green on that page when we get down to it in just a minute. But these things, so you're going to want to make sure you have proof of payment. So it's not just, you know, I bought this refrigerator and here's my, you know, this is where I bought it from. We're going to have to see where you actually expended those ARPA dollars from it. So you have to be ready to show the receipt that matches the invoice. If you use the money for rent or mortgage payments, then you'll want to track it that way. So there are those pieces. It's vital that you keep that in a separate folder. We talked about that back when we used to have the ARPA meetings. We gave you tips and tricks on how to organize your materials and your backup documentation, because remember, this is federal dollars. And so the IRS, you're going to need to claim this on your taxes. And some of you have already been through all that because you had to do it for this year for monies that you got last year. So it's vital that you keep those records and keep them accurate. On August 30th, hold on. Can I let, sorry, we're all in different offices, so yes, okay. So let's talk about monitoring for a second. I'm sorry, I heard somebody.
Just let me know when you need me to move up the
Okay,
thing.
thank you. Let's talk about monitoring. So we've had a challenge with some providers who have been chosen for monitoring not submitting their documents or not even acknowledging our request. There are consequences to that. We don't want to go there. We don't want to have to collect back your funds. If we do, we're going to have to, we do track everything. So if you've been chosen for monitoring, please allow us the opportunity to work with you. If you're nervous or you're not sure what to submit, just tell us so that we can work with you and try to make this as seamless as possible and as painless as possible. There are some providers out there who have not submitted their documentation, and we're almost to the point where we're going to have to go in to recollect your funds back. So please pay attention to the timelines because we are held to enforce those. Let me pause. Lily, is there any questions about that?
There's no questions at this time.
Okay.
Oh, wait, I was wrong. That's just when they pop up.
It's okay.
Does the Workforce Initiative 25% have to be documented for all of the payments we received? And can the taxes the employer paid to IRS be included in the total?
So that 25% is you had to give back that 25% to your staff. So yes, it does have to be documented. You cannot use part of that money to pay taxes with it. That had to go back to your staff directly. I hope I answered that question correctly. If I didn't, we can.
I just put the question in Teams for you so you can see it.
Okay. Thank you. Yeah, those funds have to be sent to you or given, however you outlined it, or whatever you decided to do that was above and beyond your typical payment to your staff. If you chose to take that additional money, because that was an option, remember, some people declined it because they weren't sure how to move forward or document it. But if you chose to take that money, it has to be invested back into your staff in a way that you wouldn't typically use it. There is guidance that is attached to your to the meeting notes. It's a download. It's the one that it's the Child Care Stabilization Subgrant Spending and Documentation Guide. Lily is showing you where to click in your Constant Contact email to get that download.
See, it works just like that, y'all.
It's beautiful.
Oh no, I lost my. There we go.
Hold please. There we go. Okay. So, but that document, that is not a document that's new. That's something that we've sent out multiple times, but it is in a link in your Constant Contact email. There it is. The beautiful thing about this document is each one of those little boxes, once you have it pulled up live, there are links to that area in the booklet. So, Lily, that is beautiful. You're navigating this wonderfully. So you can go in there and really look at that workforce investment piece. It's highlighted there, second row, second column, third row down on the very front of that document. So please review the requirements and follow what the requirements say.
We do have a few questions.
Okay, go. Go.
And okay, and I'm going to put them in Teams as well so you can visually see them as well,
Thank
okay?
you. She knows I'm a visual learner.
All right, so we have, does all of round 1 and 2 need to be spent by September 30th, 2023?
Yes. Yes, it does. And so in the tips, a little bit further down on this page, Lily, if you can scroll down, one of the
Mhm.
tips that we gave is the best way to spend this money, the easiest way to document it is either on your staff or on like your utilities, you know, your rent, your mortgage. Those are easily identifiable. They're easily documented. You have your payroll documents. Can you go a little bit further down?
Yeah.
I think there's a tips section. There it is.
Ah, there we go.
There you go. So you can use the easiest way. So my third bullet there to spend your grant funds quickly is salaries, staff bonuses, and rent and utilities. Those are easy peasy. A lot of you have already invested funds into those things. And what you can do is if you paid them out of a different pot of money, pay yourself back, but document how you did it. So if you paid your utilities out of your general revenue, that's the income from your parent fees and the different, you know, tuition fees that you get, you know, pay yourself back, make a note, you're using ARPA funds to reimburse the cost of payroll for the month of, let's say, September 2023. And then document how much money that was so that you can see, you know, you can easily track that you've spent all of that money.
Okay, so we had a follow-up from the first question. And
Okay.
the 25% is on the total of all the each round of payments we received. When documenting the ways we spent the money, can we lump all of the payments into one, or does each round have to be documented separately?
It does need to be documented separately because it's going to be a different amount of money for each one. Because remember, we're talking about a percentage and the payments were not the same for each ARPA grant. So ARPA round 1 was paid in 3, that was paid in 3 equal payments. So that one you would document that percentage right there and how you spent it. For ARPA round 2, that was one lump sum payment. So that percentage, it wasn't the same amount that you got for round 1, if you recall. So you are going to have to document those separately. And those each round of ARPA is monitored separately. We are required to monitor them individually.
And Melanie, you can feel free to email ARPA if you have more questions, and we can have.
ARPA@elc-marion.org.
And I almost volunteered you, but I was going to say I'm sure somebody will reach out to you. I was going to say
feel
Elizabeth.
free if you have further
It may not be
questions.
Elizabeth. It may be someone from the team.
Yeah, a lot of you have been working with Elizabeth Bench, and she has done a really good job trying to keep up with everything, but feel free to continue to reach out to ARPA@elc-marion.org. It does go to multiple staff, and so, but Lizzie is our main person there, so, and Joseph.
Okay, we have a couple more questions.
Okay.
When you were originally talking about the payroll, there was a question to clarify, not as, let me read this, not as standard payroll, but as extra, correct? And I put it in
Correct.
Teams for you.
Yes,
Okay.
so when we go down to what is allowable, I've had this conversation with a couple people. So when we, Lily, I don't know if you can go back to that document and click on, so we can put it on the screen. It's the Child Care Stabilization Subgrant Spending and Documentation Guide.
Yeah, I can do that, yeah. This one right here.
It's really
Gotcha.
easy to pull. So if you click on second column down, workforce investment, it'll take us right. Yep, keep one more down. Yep, there you go. So these are the things that are allowable. It does have to be above and beyond your typical regular payroll and benefits. So they gave examples there that it's not fully inclusive, but it's a pretty good list there of how you would use those funds.
Okay, and then we
Now that's just
have,
for the extra piece. So remember I was talking about the and here's the other thing. I was talking about the budget and how you're spending your money. If you put that in your budget that you were going to spend your regular ARPA grant on payroll, that's okay. It's just this extra percentage for the workforce initiative and piece that has to be above and beyond. So you can do both as long as that's what you put in your budget.
okay, and then I have one more question for you.
Okay.
And I'm going to let you read that first while I pull up the dates.
Okay. So the question is, if we gave more than one raise to the same person, how do we show this? Do we pay through a payroll company? Or we do pay through a payroll company. Can we print one stub for the week prior to the raise and then the week of the raise to show this? Then can we do a printout of the time frame of total hours? So really what you want to do is just make sure it can be seen where that person received their increase. So that should be, it might be on the pay stub that shows on pay period 1, they were making, and this is just, I'm throwing numbers out there, they were making $10 an hour. On pay period 2, you gave them a raise. They're now making $10.50 an hour. And then fast forward a couple months later, you gave them another raise. So they went from the $10.50 to the $10.75, let's say. So as long as you can document that timeline showing where that happened, that is sufficient. And some payroll companies are able to give you reports that show that, so it's however we can see it.
And that's it for questions there.
Awesome.
Are you ready to move on?
Yep. So on your screen right now is, well, and actually let me back up for just a second and just make a general note. You don't have to get off of this page though. So ARPA round 2, actually this is great. I can just go right down here and I'll talk about it when we get there. So ARPA round 1, what this is a timeline because it's very difficult. What we've found is it's difficult for us to talk to you about the monies that you've received because so many deposits have been made. And there's so many things kind of still up in the air, things that haven't been finalized yet, things that have. And then in between all of these extra grants, you still were getting your regular payments for school readiness and your regular payments for VBK for those of you that offer it. And then some of you are even getting some additional professional development deposits from last year. We've since put that, we no longer offer that program as of July 1st this year, but there's been a lot of deposits made to you from the coalition. So the time frame, the payout ranges, it's going to be different for all of you for some of these grants, and others we paid everybody on the same day. So for ARPA round 1, this occurred between April of 2022 all the way through March of 2023. And that is because there were different timeframes of when you received your first payment. And if you recall back, we could not release a second payment until 90 days after your first, like to the T, and then the third payment came out 90 days after your second. The deadline to spend all of those dollars, again, just to remind you, is 9/30, so September 30th. Then moving forward to ARPA round 2 was one lump sum payment. Those payments went to you between January 2023 and May of 2023. Also, the deadline to spend that is September 30th. And then we moved down to ARPA round 2, final payment A. That was one payment made to those of you that participated in ARPA round 2. That payment was made to everybody in May of 2023, and that was one lump sum payment. And that deadline is also September 30th. Now you got an unexpected surprise. On August 30th of 2023, so just a couple weeks ago, you all received, those of you that received a payment for round 2 final payment A, received an additional deposit, a lump sum payment called ARPA round 2 final payment B. So the caveat with this and the eligibility criteria was that only providers who remained legally open and operating and who received ARPA round 2 final payment A were eligible for this payment. So if you didn't get it, I would say go into your provider portal and see if you can find the ARPA Round 2 final payment. I'm not sure if it says A on it, but my mind couldn't wrap around calling something a B without having an A, so I put A. Just to help keep it clear that these are separate payments. Let me pause and see, Lily, do we have any questions?
I have a couple questions, but I've already let those providers know that we'll follow up with them after the meeting. So
Great.
we can keep going if you like.
Perfect. So then number 5 on this list is your workforce initiative, moving into the workforce initiative. This was the application. This is actually a different grant called SRSA. Please don't quiz me on what SRSA stands for at this very moment, but so it's a different pot of funding. Basically, this was your application number 1 and number 2 that you uploaded to your provider portal, and we put special folders in there. This was the one that paid for, if you recruited new teachers and you paid for their background screening, that was paid directly back to providers, depending on how many you hired and what you were eligible for on that application. So that payment went out to those that applied for it on August 11th. We do have, I believe, one additional provider that has not been paid. If you are going, I applied, where's my payment? You are probably that extra provider. We anticipate payment date would be no later than October 31st. So let me talk about that date because you're going to see that repeat a little bit in here. It does seem like it's far away. I've talked to you all before about limitations on releasing dollars, right? So all of these things, when we have these grants, we have to process the applications that we receive. If we don't, we cannot pull down grant money to pay you without the application to back up the purpose for us needing to request those dollars from the state. So what happens is we went through and we found some errors, both on our part and on teacher part and provider part. We are clarifying all of those and reviewing all of the applications that we have. So if we find any additional things that we have to request funding for, we want to get everybody paid out at the same time. We want to close this out. And so we won't have the funding to actually release to anybody who's still waiting until closer to that mid to late October date. So let me keep going on that. So the next one, so that was workforce initiative number 1 for the background screening. Number 2 is your teacher retention and training. This one has been the big one. We had over 800 teachers that were processed in our county alone. This includes teachers, directors, people at your site. And this was the grant that paid for the education level and the years of service that they have provided to your site. Numerous. So when I'm saying 800 people applied, we probably had 10% of those payments returned back to us because of invalid account numbers, closed accounts, people that moved, something that was off on the direct deposit form, people that gave us a direct deposit form for a, I think one of them, we had a very different one that wasn't even an account really, it was like a utility account. So there are a lot of specifics that we have to follow when it comes to paying out teachers directly. We've learned a lot of lessons, I can tell you that, and we're really trying to make sure that we go through everything that we have on file and make sure that anybody that still needs to get paid or got the wrong amount or something like that is cleared up. So no, those people, if you have teachers that haven't gotten paid yet, anticipated payment date is October 31st, 2023. We'll do our best to do it sooner, but that is the date we're sticking to right now. Okay. Now, something else about the workforce grants there, those had to be uploaded to the portal, your provider portal, to your documents tab. I'm saying that wrong and I'm sorry, I can't remember exactly what it's called right now.
Document library.
Thank you, the document library. It's a separate area than where we see all of your license and your insurance and all that other stuff. The thing is, and I know you guys know this, but we don't know when you update something. So the system does not alert us at all that there's a document that you placed in your document library. So we have to rely on you all to follow up to say, hey, I put this, you know, I put a set of applications in my workforce initiative folder. That is an email that can be sent to arpa@elc-marion.org. And that way we know to go and look for it. For our out-of-county providers, we had you guys uploading it to BlueJean. That was a little easier to catch because we actually have a report that one of our staff members pulls from BlueJeans every day. So that's a little easier to catch. So going down to world-class workforce, and the CQI stands for continuous quality improvement. So this one, I didn't highlight it and I should have, and I apologize. Those of you that received the CQI funding, you have a deadline to spend those dollars by the 22nd. So that is this Friday. Here is where you're going to have to go back to look at your application in WebAuthor. So all of these next grants were uploaded to WebAuthor, and you can go in and look at what you were approved for. You're going to really want to pay attention to the budget you were approved for. In the constant contact email that we sent out on Friday, I gave some information about how to submit your receipts and your backup documentation. You're going to upload that to WebAuthor. Okay, this is for the Continuous Quality Improvement Grant. So the guidance for this grant, and we know you just got paid that money 2 weeks ago, and how are you supposed to spend it? The thing is, you most likely already did spend it because you had a training plan that you had to purchase. You had other things that you had to invest in. So basically, you're going to end up reimbursing yourself back for those costs that you already expended. So when you go to upload your receipts and the other backup documentation for that, you can go back to whenever your application was approved. So anything you spent towards your continuous quality improvement or CQI grant between the date that your application was approved and now, well, 9/22, Friday, you can reimburse yourself back for that as long as it's in your budget there. So in that document, that one of the tips that I put in the constant contact narrative section was like, you know, repay yourself, but pay attention to where you, thank you. Pay attention to where you spent your money. If an item costs less than you budgeted, you can add the extra funds to another line item in that grant. If it costs more though, you might have to adjust something else in that budget. So if you don't want to pay that money from another pot of money that you have from your general revenue. Let me pause because that's a pretty deep one. Let's see if we have any questions.
So we do have a question. If you received your funds late, can you still cover rent, mortgage, utilities you paid while waiting for funds?
As long as you paid, okay, two things have to happen. You have to have put that on your budget for the application that was approved. So again, I'm going to tell you to log back into your WebAuthor. And so as long as that is listed on your budget and you paid the rent after, you know, like that falls into the timeline of when after your application was approved. So it has to be on the budget and it has to fall in time frame after the application was approved, which a lot of you were approved like in June and July. I was seeing some of you may even been earlier than that. So you have the ability to go back and reimburse yourself for that, but you want to make sure you document that, upload your statement, you know, showing where you paid it. And there's a space in WebAuthor, and you might get, I've heard that some people are getting automated messages from WebAuthor, and it's a little confusing, but it's letting you know that basically we opened up your WebAuthor account so that you can upload those documents.
Okay. Melanie asked that you repeat the last statement, and Melanie, I'm guessing that it probably had to do with what she said prior to answering the question. So if you can just clarify. Oh, she said yes, it does have to do with what. So she's asking if you can repeat what you said about the tips, paying yourself, and then.
Yeah, so basically what's up on the screen right now is what was included in the constant contact email that went out last Friday. It just is going over options for you to meet this deadline of spending this money, because most likely you've already spent it. So you're just basically repaying yourself. You're going to want to log back into WebAuthor and review your application so you can see what you actually said you were going to spend your money on for this grant. This is only those that got the CQI grant. We didn't have that many. We had probably, I think, about 19.
And then where's another question about CQI? Can it go towards payroll, anything that's left over?
Well, there shouldn't be anything left over. You got to go back to your WebAuthor and look at your application and see what you budgeted, because our team worked with everybody to make sure that you budgeted the full $19,800. So you'll want to go back and look at your budget. You can spend within that budget. You can change the amounts for each line item, but that is the approved expenditure, is your budget that's on that application.
So it is 9 minutes after 9. So we're
After 2.
we want to be mindful of everybody's schedule.
Yep.
With that being said, please continue to submit your questions. I am taking note of these questions, and I will be very, very happy to make sure these questions get answered. We'll get them to the right people. So please continue submitting your questions. But for the purposes of time, do you want to continue going down?
I just want to, well, you all have this, so please look at it. If you have any questions, do let us know. Lily is taking your questions. You can put them in the chat here. That would be great, because then we know it's tied back to this meeting. The other piece I just want to throw out there is we just finalized another grant application that is going to be bringing some really exciting programming coming up real soon here. So I'm really proud to say we just acquired another $3.8 million in funding to support our childcare providers, and that's going to roll out in a lot of different ways. So as we offer different information sessions, or we're offering, as we bring up different topics, it's going to be really important that you're on the next provider meeting. And we will I might even do an information session between now and then, because we don't want to wait that long. So there's some really exciting things coming. Dolly Parton Imagination Library, that's more towards the families and the parents. The incentives program, we're going to kick that off here in Marion County. We have another grant coming up to help you buy classroom furniture. It's really exciting, really, really exciting things that are going to be happening. So more to come on that. That's a little teaser, so you have to come back next time. We will definitely talk to you later, and thank you for indulging me and letting me go over, because this is really important stuff.
Thank you, everyone. Oh, one last question. If they need to, can their WebAuthor application be reopened?
If they say that again,
can you reopen our application in WebAuthor if submitted too early?
If submitted too early, meaning you didn't have all of your backup documentations uploaded? That's what I'm thinking. You're saying you cannot change your application in WebAuthor. Okay. So we can't adjust that, but we can.
I'll just put down this provider's name and you can reach out to them.
Okay, that sounds good.
Yep. We'll get to you, Christy. Don't worry. Christy, Lisa, and Melanie, I have your names. I have your questions, and we will get them taken care of. I promise.
Yes, definitely, for sure.
You know me. I may not know the answer, but I'll find out who does. All right, y'all. Thank you,
everybody. We appreciate you so much.
Good and wonderful day, and please, please, please give your Give for Marion flyer in your provider packet a gander. And if you feel to do so, just know ahead of time we thank you for any donations. Have a wonderful day, y'all. Bye-bye. Can you donate by check? I'm pretty sure, Lisa, that is possible. Check out the flyer. Or I can have Wendy reach out to you. We'll have somebody reach out to you and help you out. We'll be talking to you about ARPA anyway. Thank you, Lisa.